Good afternoon. Welcome everyone to today's Learning Series webinar. Thank you for joining us. I'm Melissa Moreno with the CMS National Training Program, and joining me is our speaker, Mr. David Santana, also with the CMS National Training Program. He'll be presenting our topic, an overview of 2018 Medicare costs. But before we begin, I'd like to go over a few technical details with you. First of all, our lines for this webinar are all muted so that everyone can have a good learning experience. You can ask your questions by using the Ask a Questions tab, and the slides for today's presentation are available for download as a PowerPoint or as a PDF by selecting the Event Resources tab. Both of these tabs are located on the left side of the screen. I also want to remind participants that this call is intended as an informational call for our partners. It is not intended for press purposes, and it's not on the record. If you're a member of the press, please email our press office at press@cms.hhs.gov. This CMS National Training Program webinar provides basic information on the Medicare program, but you should always consult the relevant statutes, regulations, and rulings for official legal guidance. And now I'll turn it over to our speaker, Mr. David Santana.
Thank you, Melissa, and hello and welcome, everyone. Thanks for joining us today. We are planning to provide kind of a brief overview of the Medicare cost for 2018 for this year. Unfortunately, we do not have the new federal poverty level that will apply to this year. We were hoping that those numbers will be out by now, but again, those numbers are not out, so this is not a complete update of 2018 Medicare costs because we're still waiting for those numbers. And of course, when those numbers are released, are going to impact eligibility for example, low-income subsidy for the extra help, and also the Medicare savings programs as well. So again, I wanted to just bring that up because we will be looking for those new numbers in the next coming days. So we're going to do a quick review of the Medicare choices because, of course, the choices that you make with regards to the Medicare coverage will affect, of course, the cost that you will pay for the program. So we're going to do a quick review of those choices. Then we're going to dive in to talk a little bit more about or specifics about Medicare Part A hospital insurance as well as Medicare Part B cost for this year. We're going to do a quick review of Medicare Advantage and also talk about some costs with regards to Medicare prescription drug coverage. So we mentioned that, of course, when you consider Medicare costs for 2018, it all depends on the choices the individual makes with regards to Medicare enrollment. So usually the typical individual that comes into Medicare will have the option of Medicare Part A hospital insurance and then Medicare Part B, which is the medical insurance. If you do remain within that original Medicare option and you do not have, for example, Medicaid, TRICARE, Federal Employee Health Benefits Program, private employer that will pay after Medicare, and other sources of prescription drugs, the typical individual that remains within this track will seek to enroll, for example, in a Medigap policy to cover, to supplement the original Medicare program. And also, if that individual wants prescription drug coverage and they don't have drug coverage through other choices, they need to look into the possibility of enrolling in a standalone prescription drug plan, which again, that is going to add up to the cost. So first you have the Medicare for the typical individual and Medicare Part B cost, and then the Medigap policy as well as the prescription drug cost. So they have to take into account that there may be 3 premiums that they would have to pay to get a complete coverage under the original Medicare. The second option is, of course, to have original Medicare Part A and B and enroll in a Medicare Advantage plan. So the majority of these individuals, of course, would have to pay for Medicare Part B premium, and the majority of the Medicare Advantage plans, of course, would have an additional premium to pay on top of Medicare Part B. The majority of Medicare Advantage plans do come with prescription drug coverage, so usually that premium will include the typical Part A, B services and additional services, as well as prescription drugs. So what a typical individual paid in 2018 for Medicare Part A? So the majority of people in Medicare, in fact 99% of people in Medicare, would not have to pay a monthly premium. That is because the individual or their spouse accumulated the required amount of working credit. There's usually 40 credits of coverage or 40 work credits. This year, an individual can earn a credit for every $1,320, and they can earn as much as 4 credits a year. So that would be, if an individual makes $5,280 in the first month, of course they already accumulated the 4 credit for that year. So again, the majority of people in Medicare will get Medicare Part A premium free. However, about 1% of the population do not qualify for Medicare Part A premium free. Those individuals will have the option to purchase into the Medicare Part A hospital insurance. As you can see on the screen, if the individual has at least 30 credits or more, no more than 40 credits, that premium will be reduced, or the Medicare Part A premium will be reduced by 45%. So again, if an individual have at least 30 credits, 30 work credits, but no more than 40. Those individuals that do not have any work credits or less than 30 work credits, they will pay the full Medicare Part A premium, which for this year is $422 a month. I will remind everyone that those individuals who have limited income and resources could qualify for Medicare savings programs, and we'll do a quick review of the Medicare program, or the Medicare savings programs in a little bit. But again, those individuals that typically don't have the work credits, they may be low income and they may need to be looking at applying for Medicare savings program to get help from the state to pay for Medicare Part A as well as Medicare Part B premium. Also, those individuals that do not qualify for premium-free Medicare Part A, they need to look at when they need to enroll in Medicare. As we all know, to enroll in Medicare, you have to do it during a prescribed enrollment period, specifically for Medicare Part B. Those same prescribed enrollment periods apply to premium Medicare Part A. That is around 7 months, your 65th birthday. They also qualify for the same special enrollment period if they're actively working, and they also have the ability to sign up during the general enrollment period. Now, what differs here from Part A and Part B is the penalty that individual paid. So the penalty for Medicare Part A is capped at 10%, and is limited to twice the number of years that the individual waited to enroll in Part A after their initial enrollment periods. So if they waited 1 year, a 12-month period has passed, they will pay 10% penalty for 2 years. If they waited 2 years, then they'll pay 10% penalty for 4 years. So again, the penalty is capped at 10% and is also based on twice the number of years that the individual waited to sign up for premium Medicare Part A. So again, this is different from the typical Medicare Part B premium penalty. Individuals that qualify for premium-free Medicare Part A can enroll in Medicare at any time after they turn 65, there is no waiting period, there is no penalty. After the individual turns 65 or before 65, when they apply for Social Security retirement benefits, that is basically the same application for Medicare Part A. So again, if they already applied and were qualified for Social Security benefits before they turn 65, they will be automatically enrolled when they turn 65. If they are over 65 and they haven't applied for Part A, whenever they apply for benefits, that same application will serve as enrolling that individual in Medicare Part A. Now, in addition to the premium that individuals paid for hospital insurance, this is the same as any other health insurance that individuals have or any other type of insurance, whether it's auto insurance, homeowners insurance, or health insurance. You have the premium piece, and also you have the out-of-pocket expenses when you utilize those services. So with regards to Medicare Part A, there is a deductible for this year is $1,340, and that is when the individual become inpatient in the hospital, and that lasts for 30 days. So that will cover the individual hospital stay for 2 months. Now, if the individual stays in the hospital for longer than 60 days, as you can see, for the next 30 days, the individual will be required to pay 1/4 of that deductible, which is $135 per day up until they reach that 3 months in the hospital. So the Part A benefits basically runs for 3 months, for 90 days. There is, however, a lifetime reserve date up to 60 days that the individual could use over the lifetime again. And as you can see, they would have to pay half of the deductible per each day beyond the 3 months. Once they use that lifetime reserve date, again, their hospital coverage will be limited to 3 months per benefit period. For the first benefits periods, if they have the 60 days lifetime reserve days, you can see that after that 5 months in the hospital, the individual is responsible for all costs with regards to the room and board and everything that is covered under Medicare Part A. And again, once they spend that 60-day lifetime reserve days every time they come to the hospital, the coverage will usually be for 90 days, and those numbers will recycle. So the benefits period will recycle every time the individual has been out of the hospital or skilled nursing facility for 60 days in a row. We also get a lot of questions. After the Affordable Care Act, all the insurance companies were required to provide maximum out-of-pocket protection, or some of you may recognize this by catastrophic coverage. As you can see, there isn't a catastrophic coverage under Medicare, so there isn't a maximum out-of-pocket expenses whereby when the individual reaches a certain amount of money out of pocket, that Medicare will pay 100%. So that doesn't really exist on their original Medicare. Now the next slide just basically shows the out-of-pocket expenses also when the individual, when they leave the hospital and need a skilled nursing facility care, and of course they do have to meet certain requirements to qualify for a skilled nursing facility care, rehabilitation care, that can only be provided in an institution after they leave the hospital. You can see that we do pay at 100% for the first 20 days. From day 21 to day 100, they do have a copayment of $167.50. If they remain in a skilled nursing facility after that, they are responsible for all costs in the skilled nursing facility. And again, after they get out for at least 2 months, if they come back to the hospital and they meet that 3 days qualifying stay and other requirements, these numbers will recycle again. Now let's focus on Medicare Part B. Medicare Part B is a voluntary coverage that individual can choose to enroll. If the individual chooses to enroll in Medicare Part B, there is a monthly premium, and everyone pays for Medicare Part B monthly premium. If they have heard that, if you heard somebody that is not paying, it's because, or typically someone else is paying on their behalf. So the standard Medicare Part B premium for this year is the same as last year, $134. It could be higher, of course, depending on the income, and we're gonna take a quick look at the income threshold in the next slide. Now, there are also some people who get Social Security benefits that will pay less than this amount, and that will be about $130 a month. The standard premium, however, will apply for anyone who enrolled in Medicare Part B for the first time this year. They didn't get Social Security benefits last year. They are billed for Medicare Part B premium, meaning that it's not taken out of their Social Security or railroad check. For example, have Medicare, Medicaid, and the state is paying for their premium. And of course, those who their modified adjusted gross income fall under the higher threshold, and they are required to pay more for their premium. The yearly deductible, also Medicare Part B, do have a yearly deductible, $183, and thereafter the program pays about 80%, and the individual is responsible for 20%. Now, this is the standard premium and the modified adjusted gross income that we're looking for this year. Now, since 2007, people in Medicare have been paying more if they fall within these income thresholds. To understand a little bit about how the Medicare Part B premium works, the government subsidizes about 75% of that premium, the Medicare Part B premium, and the typical individual is responsible to pay 25%. So that $134 represents about 25% of the Medicare Part B premium. To see the true Medicare Part B premium, you will multiply that number by 4. And as you can see, that will be about $535.80. That is actually the Medicare Part B premium. And then again, the government subsidizes 75% for the majority of people, and they're responsible for that 25%, which represent the $134. Now, those individuals that fall above this income threshold, that we have $85,000 for singles and $170,000 for married filing joint taxes, they will pay, instead of 25, they will pay 35%, 50, 65, and 80% respectively. So those numbers, again, that you see in there basically represent 35% of the premium, 50, 65, and 80%. So as you can see, even for those higher earners on the last row, the government still subsidizes 20% of their Medicare Part B premium. These thresholds are set to stay the same until 2019, at which point they may be recalculated to include the Consumer Price Index. So we may be looking at those numbers to increase after 2019. Now, how do people pay for Medicare Part B premium? So if the individual is getting either Social Security checks, railroad, or federal retirement benefits, federal retirees, that premium will be deducted from their benefits payment. So an individual who receives these benefits payment do not have the option to pay their premium otherwise, unless, for example, if an individual is getting a Social Security check that is not enough to cover their Medicare Part B premium. Of course, they will be the amount that they get may offset some of the premium, but then they're going to be billed for the rest of the premium due. for those, again, that their Social Security check is not enough. Now, for individuals who do not get any of this benefits payment, the typical individual will be billed every 3 months for their Medicare Part B premium. We also have the option of Medicare Easy Pay, where the individual will fill out the form and send it to our payment center to set up an automatic collection from their bank account every month. Now, I mentioned in the beginning when I was referring to Medicare Part A premium, which is pretty high for the typical individuals, and needless to say that the government does not subsidize anything with regards to Medicare Part A premium. So you heard me talking about Medicare Part B, that the government subsidized 75%. So there is no subsidy from the government for Medicare Part A premium. That's why it is so high. However, we encourage individuals who have to pay the premium to look into Medicare savings programs as the QMB, the SLIM-B, the qualified individual, and also the qualified disabled working individual. The next slide gives us a better picture in terms of the qualification requirements for those programs to help individuals pay for their Medicare Part B and Medicare Part A premium, as well as out-of-pocket expenses. So the first group in here is the QMB, which is the group that gets pretty much everything. Those are typically below 100% of the federal poverty level, and they will get the state to reimburse them for their Medicare Part B premium, Medicare Part A premium, and also Medicare out-of-pocket expenses. So this is the individual that will get almost complete coverage from Medicare, as well as the QMB program. Specified low income goes from those individuals who are above 100% of the federal poverty level up to 120%. As you can see, we subsidize the Medicare Part B premium, and also the qualified individual, which goes up to 135% of the federal poverty level, also get the Medicare Part B premium subsidized, or help pay for the Medicare Part B premium. And lastly, the qualified disabled working individual. The typical individual that qualify for Medicare based on disability, if they return to work and they don't qualify for Social Security disability benefits, mainly because they're making too much to qualify for Social Security payment, they will be able to retain Medicare for an additional 8.5 years. After that, the individual will have an opportunity to purchase Medicare Part A going forward. Those individuals up to 200% of the federal poverty level can get the Medicare Part A premium or help to pay for the Medicare Part A premium from the state. Now, going back to that slide on the beginning that we were talking about, the group of individuals that remain within the original Medicare track, if they don't have any other health insurance that will supplement Medicare, they usually will look into Medigap policy. And what are the costs of Medigap policy? Well, the cost of Medigap policy depends on many factors, and of course how the state regulate how those insurance companies can price a policy. For example, issue age policy, community policy, age-rated policy, and so forth. The type of Medigap policy that they choose, of course, is going to affect how much they're going to pay, whether they're going to be subject to medical underwriting. If they are not protected under the time frames that we allow or we require those individuals to enroll, if they enroll within those time frames, they will be protected from, for example, medical underwriting. But if they do it outside of that time frame, medical underwriting, of course, may affect how much they will pay for those policies. There's also discounts available for women, married couple, individuals that are not smokers, and so forth. And And again, of course, depends on where the individual lives as well. So those are the type of things that individuals need to take into account when they're thinking about purchasing a Medigap policy and the different factors that may affect how much that policy costs. I mentioned the time frame that we allow the individual to buy a Medigap policy so they can be protected from, for example, for medical underwriting or denial or charging more. So the best time to buy a Medigap policy, of course, is within the 6-month open enrollment period, which occur when the individual is both 65 and enrolled in Medicare Part B. So during this time, the company cannot take into account, for example, the individual age or pre-existing medical conditions to put any hold on their policy or to charge more. If the individual do not enroll within this 6-month period, then there's always the guarantee issued period under federal statutes that guarantee that individual to get a Medigap policy at the reasonable cost and without going through any underwriting. In addition to the federal protections, states have, of course, much more flexibility, and they may offer much more protections for individuals to protect them from either denial, medical underwriting, or those policies to charge them more. Now, with regards to Medicare Part B or prescription drugs, as I mentioned, individuals that remain within that original Medicare tract, they may need to look into buying a standalone Medicare prescription drug plan. So the monthly premium, of course, depend in the plan that the individual end up enrolling, and also the same income adjusted monthly amount, or IRMA, that will apply also to Medicare Part D, although the formula in there to apply it is a little bit different than Medicare Part B as in boy. So again, when we look at Medicare Part D, there are two parts of it. One is the premium, and the other one is the out-of-pocket expenses. So the plans are usually, or the benefits package in the plan is divided in 4 phases. One is the deductible. The other one is the initial coverage limit, that when between the individual and the plan spend about $3,750, including the deductible, then the individual fall into the coverage gap. Under that coverage gap, the individual will pay about 35% of the covered brand name drugs, and they do get a 50% discount from manufacturers. They also pay 44% for generic drugs. Once they excuse me here, that it seems like my battery was dying. I hope that we can finish here without my computer dying. I apologize for the interruption. So again, once the individuals spend about $5,000 out of pocket, then the company will step back in and pay about 95%, and the individual is responsible to pay 5%. I mentioned the Medicare Part D income-related monthly adjusted amount, and again, the thresholds in here are pretty much the same as we saw under Medicare Part B. The formula that we use to calculate these numbers is a little bit different. It's mainly based on the Medicare Part D base premium, which this year is $35.02. Melissa, I think my computer is shutting down, so if you could just go ahead and pull up the slides, and I apologize.
Sure, no problem.
Let me see which slide, and I just keep talking from the slides in here.
You're on the Part D IRMA slide, correct?
Yes.
Okay, so would you like to move to the next slide or stay on this slide?
Let me just get there in a minute. Okay, yes, if you could just move to the next slide, which is slide number 16.
Okay, I'm there.
So the, of course, same as Medicare Part B, costs can be impacted, of course, by when the individual choose to enroll in Medicare Part D. There is a higher premium, of course, or a penalty if the individual go without credible coverage for longer than 63 days. The Medicare Part D penalty is 1%, which is based on the on that base premium that I just mentioned, and it's a 1% for each month that went by, and the individual could have had enrolled in Medicare Part D, but they choose not to enroll. Next slide, Melissa. So the next slide is just basically break down what I just explained a couple of slides ago with regards to the typical package of the Medicare prescription drug benefits. That we do have a phase where the individual pay a deductible. Not all plans have a deductible, and not all plans have the same structure that you see here, but this is kind of the typical package that insurance companies offered. So you have the deductible, and then you have the initial phase whereby the company pay about 75%, the individual paid about 25%, up until you reach that $3,750, and then you fall into the coverage gap. And then after the coverage gap, the plan step in and pay about 95%, and the individual is responsible for 5%. Next slide, Melissa. Now, the next slide is just basically mentioned. As you know, the Affordable Care Act is aimed to close the gap on the Medicare prescription drug benefits. As you can see, this year, the individual will be paying 35% for brand name drugs. Next year, they're going to be paying 30%, and by 2020, they're going to go to pay 25%, and it will remain like that throughout the program. So from the beginning to end, or from the beginning through the coverage gap, the individual will pay about 25% of the cost of the drugs. Next slide, Melissa. And that slide basically talk about extra help. Of course, same as I mentioned for the Medicare savings programs, there's extra help to help people with their prescription drug cost. And the next slide just offered a little bit more detail, the income and resources with regards to 2018 to qualify for assistance to pay with their prescription drugs. And the next slide, Melissa, which is qualifying for extra help, just highlighting the fact that there are some individuals that automatically qualify for extra help. Those who have full Medicaid coverage, Medicare and full Medicaid, SSI, and also that those individuals that I mentioned that qualify for Medicare savings programs. So these three group of individuals, they don't really need to apply. They automatically qualify for extra help, for the extra help for LIS. All others may apply through Social Security administration, whether online or they can fill out a paper application. Next slide, Melissa. And the next slide just basically break down on the level of extra help that the individual get in 2018 and how much they pay out of pocket. So as you can see, an individual who live in an institution don't have out-of-pocket expenses, as well as those who are receiving home and community-based services through a waiver. And then the next level are those who are below 100% of the federal poverty level, that they will basically pay the least, $125 and $3.70 for brand name, respectively. The next level is a full extra help for individuals that are above 100% of the federal poverty level, and that could include SSI, that could include Medicare savings programs, and so forth. They will pay a slightly higher co-payments when they go to the pharmacies. And of course, the last the last group will get $83, and they will pay about 15%. $83 for the deductible to cover the deductible, and they will pay about 15% at the pharmacy counter when they go and get their drugs. The next slide, slide 23rd, I believe it is. And this slide just basically talks a little bit about Medicare Advantage Plan. So with regards to Medicare Advantage Plan, of course, the premium depends on the plan that the individual choose to enroll. And of course, they do need to take into account that the typical individual you have to be enrolled in both Part A and B, so you have to take into account that Medicare Part B premium, and in addition to that premium, then you will pay the Medicare Advantage premium. And in addition, once you go and receive services, you may have deductible, coinsurance, and copayments that are not necessarily the same as the original Medicare program. Medicare Advantage plans are required to pay for all services that the original Medicare pays for, and they usually provide additional services to encourage individuals to choose those plans. But again, the deductibles and coinsurance and copayments that you would have under those plans will not be the same as the original Medicare. However, I mentioned also in previous slides that Medicare do not have maximum out-of-pocket protection or catastrophic coverage. However, those individuals who choose to enroll in Medicare Advantage plans, we do require Medicare Advantage plans to offer catastrophic coverage. And as you can see, for this year, about $6,700 catastrophic coverage. That means that once the individual spends that much out of pocket, then the plan will step in and pay the rest of the cost for that year. And then next year, of course, that number will go back to zero. But again, the maximum out-of-pocket protection remains there. Slide 24, 25, 26 provide different publications, websites, links, and resources that you can use to find more information about what we discussed in this presentation, such as coverage and cost for Medicare. And again, we apologize that we don't have the federal poverty level yet for this year, but we're expecting those numbers that will come out in the next few days or weeks. With that, Melissa, I'm going to wrap up and see if we have any questions.
Thank you so much, David. That was a lot of helpful information. And we do have some questions. So for those of you that have been waiting for a response, this is the time where I'm going to read your questions aloud to David. So we'll start off with a long list, so let me get to these questions. All right, the first question is the deductible the same for all types of inpatient hospital stays? For example, is there a different inpatient deductible for a psychiatric hospital stay versus a regular hospital inpatient stay?
Well, the deductible is the same regardless of the type of service that the individual is getting in the hospital.
Okay. And the next question goes back to eligibility for premium-free Part A. They would like for you to explain the work credits again, and are the work credits over a lifetime?
So I mentioned that the individual can earn up to 4 work credits every year. That's why the typical individual that works 10 years will accumulate the 40 credits within those 10 years. For this year, for every $1,320 the individual earned within the year, they accumulate 1 credit. So again, if you if this year in the first month of this, in January, the individual made $5,280, that individual already accumulated the 4 credit for this year. Because again, you accumulate 1 credit for each $1,320. The credit don't have to be consecutive. So let's say you accumulated 4 credit this year, and you did not work for 2 or 3 more years, and then you came back to work and started accumulating credits. You already have 4 credits, then you're going to start accumulating credits again up until you reach the 40 credits, 40 work credits. If you worked the remaining numbers of years to accumulate those credits. So I hope that clarified the question on how do you accumulate credits.
Yes, thank you very much. So our next question is concerning the 20% copay for Part B. This person wants to know, does the 20% copay count towards the $183 Part B deductible, or does the beneficiary have to pay that amount first and then start paying the 20% copay after they've satisfied the deductible?
Great, thanks for the question. So again, as every other policy that you may have, whether it's a health insurance or automobile policy or homeowners, deductible comes first. So the deductible is the amount that you pay before your company pays anything. So you will satisfy the deductible first, meaning you will pay that $183 of the first, whenever you get the service that year, whether it's January or March or April. If it amounts out to $183 of coverage, then that you will pay first. Thereafter, then Medicare pays 80%, and you're responsible for the remaining 20%.
Okay, thank you. So I have 2 questions that are related. The first is the QDWI program available in all states?
The Qualified Disabled Working Individual program should be available in all states. My understanding is that it is available in all states.
Okay. So related to that, if the person does not have Part A, how is their disability defined?
Okay. So to qualify for Medicare based on disability, the individual would have to apply for Social Security disability benefits first and qualify. Once the individual qualifies for disability benefits, they will start receiving monthly cash payments. 24 months later, they will be automatically enrolled in Medicare. So Medicare Part A will come automatically. They don't have to apply it. It's part of the package. Now, if that same individual remains disabled, but many go back to work and they start earning more than the allowed amount to keep receiving the cash benefit from Social Security, they can retain Medicare for an additional 8.5 years after returning to work. Now, after 8.5 years, if they're not 65 yet, they will lose Medicare. And that's when the option of purchasing Medicare Part A comes in. If they are up to 200% of the federal poverty level, then that's when the Qualified Disabled Working Individual comes in. They can apply through the state and see if they qualify for the state to help them pay for that premium.
So the next question is relating to costs that can be incurred through a Medicare Advantage plan. Is someone able to enroll in a Medigap product as well as a Medicare Advantage product?
Good question. So the law prohibits the sale of Medigap policy to someone who is enrolled in a Medicare Advantage plan. So it is against the law. Medigap policies are strictly designed to cover after original Medicare. So again, it is against the law for a company to sell you a Medicare policy if you're already enrolled in a Medicare Advantage plan, because they simply do not work with Medicare Advantage plan, meaning that they will not pay after Medicare Advantage plans.
Right. Thank you. So the next question is, if you're 65 years or older, you're still working, and you get a letter from your employer stating that their prescription drug coverage is not creditable coverage, how long do you have to sign up for a Part D plan without a penalty?
They will have 63 days after they lose creditable coverage to sign up for Medicare Part D without incurring a penalty. So they do have that enrollment period that they can sign up for Part D. If they go more than 63 days after that policy terminates, then of course they could incur a penalty.
Okay, thank you. Our next question, they heard the expression closing the gap for prescription drug coverage, and they thought that meant that the coverage gap was going away completely. Is that not the case, or is it ultimately just going to stay at a 25% copay?
Great question. The gap itself is going to remain there. What is going away is the cost that the individual have to pay within that gap. So when you look back to that benefit structure, the benefit structure is going to remain the same. You may have a deductible, and then you have the initial coverage limit. I believe that was $3,750. So that will remain the same. After that, the individual between the individual and the plan spend that much, then you go into the gap. What will change is the fact that the individual will remain paying 25% through that initial coverage limit and through the gap, and then at the end of the gap, then the plan will step back in and pay about 95%, and the individual pays about 5%. So we're bridging the gap. So the gap is there, but we're bridging the gap. So the individual will remain paying 25%, from the initial coverage limit all the way up to catastrophic.
Okay, thank you. So the next person wants to clarify how someone related to the cost they pay in the coverage gap for Part D. They want to, for you to please clarify that what counts is what the beneficiary pays out of pocket and what the plan pays, or are they confused?
So with regards to what is count towards the coverage gap to meet the catastrophic is what, so during this coverage gap for brand name medications, the drug manufacturers subsidize 50% of the cost. That 50% count towards the out-of-pocket, as well as the percentage that the individual pays out-of-pocket will count. So again, the 50% that the company, the manufacturer subsidize, plus what the individual pay will count towards the coverage gap. The percentage that is subsidized, however, doesn't count, because again, it's out-of-pocket expenses. And part of the out-of-pocket is the 50% discount from manufacturer and the percentage the individual pay.
Okay, thank you. Our next question, would TRICARE coverage qualify as a Part D plan?
TRICARE coverage is considered creditable coverage, if that's where the question was. It is considered creditable coverage. So if you do have TRICARE, there isn't really a need to enroll in Medicare Part D because TRICARE do offer a pretty comprehensive package of drug benefits that is typically, again, comparable and even more than Medicare Part D. So it is creditable coverage, but as long as you have TRICARE, you don't have to worry about, being penalized or perhaps even paying more.
Okay, thank you. So we have time for a couple more questions. Our next one is related to the cost that someone has while they're enrolled in a Medicare Advantage plan. Once they have that plan, if they decide that that's not right for them and they don't like the costs and the way that they have coverage, are they able to switch back to a traditional Medicare if they want, and what is the process for that?
So once you are enrolled in a Medicare Advantage plan, again, you have to do it within a prescribed enrollment period, around your 65th birthday, and there's also a special enrollment period. So once you enroll in that Medicare Advantage plan, you're kind of locked into that plan. We do allow individuals, for example, from year to year, for example, after December, if you enroll during the annual open enrollment period, we allow you from like January through mid-February to disenroll from those plans if you don't like the plan. If you remain enrolled, however, during that phase of Medicare Advantage disenrollment period, then you are locked into the program. We do have a special enrollment periods throughout. For example, if you qualify for extra help, that's one qualifying that you could disenroll and change plans. If you move out of the service area, for example, you may be able to disenroll and re-enroll or go back to original Medicare and on the new area. So there are many more instances that you are able to get out of that plan, but typically, typically you would be locked into the Medicare Advantage until you qualify for a special enrollment period, or you could always get out during the annual enrollment period, and that happened towards the end of the year.
Okay, great, thank you. So our next question here is, someone would like for you to please explain what the Part A buy-in is for folks who have low income and they don't have enough work credits to be eligible for premium-free Part A.
So again, going back to the Medicare Savings Program, let me see what slide number is that. If you have limited income and resources that you could qualify for the Qualified Medicare Beneficiary, the QMB program, the state could help you pay for your Medicare Part A premium. That's what they call Medicare buy-in. So if you do apply and qualify for the QMB program, the state typically will help you pay for Medicare Part B and Medicare Part A premium. So for Medicare Part B, all the 50 states in the U.S., if you qualify for the QMB, typically, even if you didn't apply when you should have applied for Medicare Part B, the penalty will be, there would be no penalty. The state will go ahead and enroll you in Medicare Part B, and then they just pay your premium thereafter. There's no late enrollment penalty. There is a group of states also. We gave the option way back in the 90s that the states will have the ability to do the same thing for Medicare Part A premium. Not all the states chose that option to go ahead and enroll all individuals in Part B and Part A, and no penalty apply for either Part B or A. There are, however, a group of states that chose not to take that option. That means that if you live in a state that did not take that option, then your enrollment in Part A has to be done same as I explained. They have to be done during the prescribed enrollment period. So I don't have the list of the states in here that shows that option, but I would recommend to check, with either the CHIP individual in the state or the Medicaid office to see what option applies to the specific state that you live in. But in general, if you qualify for QMB, the state will help you pay for Medicare Part A and Medicare Part B premium. And even if you have to pay a penalty for Part A, if you qualify for QMB, the state may help you pay for the entire premium, including that penalty.
Okay, thank you very much. I think that's going to be all of our questions for this session, David. Thank you so much for your expertise in answering the questions and presenting this information for folks. We hope for some of you it was a good refresher and that others of you learned some new information and had your questions answered. And with that, I'm just going to remind everyone that this last screen is information about us at the CMS National Training Program. And the link that you see there is to join our email listserv, where you can receive email notifications for upcoming trainings. If you had a question today that didn't get answered, or if you need the slides, let's say, for example, you weren't able to download the slides that are available under the Event Resources tab, you can send the email request for the slide deck to us at the link that you see at the bottom of this slide. That's training@cms.hhs.gov. Also, this webinar has been recorded, so please feel free to check our website on cms.gov for updates to our web events section, where we will post this recording within about 10 days. And with that, if you would like to join us for our next Learning Series webinar, it will be held on March 8th. So thank you again for joining us. Thank you, David, and everyone enjoy the rest of your day.
Thank you.